usually the person that's saying you need surgery?
The neurologists and the orthopedic doctors, they're usually at a standstill and they don't know what else to do. They've been through the ropes as far as trying the meds, the corticosteroid injections, the epidurals. Sometimes the patients have already tried physical therapy, even chiropractic, to no avail. And you know, they're scheduled for surgery when they're usually coming to see me. They're coming to me as a last resort.
Already scheduled.
Already scheduled, most of them.
Wow.
Coming in walking with canes, some of them walkers, some of them, you know, holding on to their loved ones, barely can walk. It's real sad. But we provide them a lot of hope in our practice, and it really works.
And how do they find you? Well, you said the neurologist might refer them. So
we get referrals from the neurologist, orthopedic doctors. Some of them find us in the Citizen. We do some advertising in there. But, you know, to tell you the truth, most of our patients are referred by other patients.
Wow. How do they start therapy or IDD therapy? Do they get it that day? Is it next day? How do you...
Well, some patients, they are needing to talk first to their spouse if their spouse is not there. So it takes a little bit of time for them to digest the information. I'll usually sit there with them and go through a consultation. I'll explain the entire process of IDD first. I'll even go over their MRIs, because a lot of times the doctors that they've been to didn't sit down with them to go over the MRI. So they're just knowing that they have this so-called herniation, and they don't really understand what it is that is. And so I actually sit down with them and I show them the models. I describe to them precisely what a herniation is, or a disc bulge, if it's a disc bulge that they're dealing with. And we go through it step by step. I spend sometimes up to an hour with them so that they totally understand exactly what's going on. So they totally understand why they're having numbness and tingling, why their back hurts, why they're having the muscle spasms, why they can't walk anymore. We go through those scenarios with every single patient. And they do not leave out of there without a clear understanding. And my cell phone number.
Sure. And that I think is a lot of it, is not understanding what's going on, and then going into a surgery you may not understand either what, you know, just the confusion and fear.
Exactly.
So you're clearing that up right away.
That's right.
Or doing your best to, and I'm sure, you know, you can actually show them what it is, because it's, like you said, if you look at a bulging disc, you can tell that that's what it is, you know, so they can understand it.
And, you know, a lot of patients, they've never heard of spinal decompression, and when they hear about it, it just gives them a tremendous ray of hope. That I've had patients just break down and cry in my office, because they are just so relieved that there's actually something that can be done without undergoing the knife. It's incredible, the changes that we've seen in our office with just something as such as special as IDD therapy.
If you are suffering from a disc bulge, sciatica, a ruptured disc, stenosis, or facet syndrome, IDD therapy, non-surgical decompression, may help. Contact Dr. John Thomas immediately for a free educational consultation. Call now. 770-460-1911. Stop suffering and don't delay. Call Allied Healthcare Clinics today. 770-460-1911. Visit us online at provenbackpainrelief.com.